Says Abia COVID-19 update. Abia COVID-19 update.
The COVID-19 pandemic has unleashed change that seemed unthinkable just a few months ago. COVID-19 pandemic has changed life as we know it, as the rate of infections begin to slow down in some hard-hit areas. Early signs of recovery are appearing. Some towns, cities, and states are starting to slowly reopen businesses, public areas, and more. Until a safe, effective coronavirus vaccine is available, there will continue to be a risk of infection, even as people get back to work, school, and more normal life. But don't forget to keep abiding to the protective practices. It's a new month, and it is the first edition of the program in the month of July 2020. This is Abia State COVID-19 update. My name is Chioma Nkwanta. Today's edition is a special one as we are having a two-way conversation. Michael Oni is standing by at Amachara, Umuahia to be precise, the Abia State Specialist Hospital and Diagnostic Center. Good morning, Michael.
Good morning, Chairman. Can you hear me?
Yes, I can.
Well, the basic fact of COVID-19 is that it is a respiratory disease that is transmitted through respiratory droplets and a person-to-person contact. And correspondingly, the basic preventive measures are hygienic practices of frequent hand washing, respiratory good manners, physical distancing, environment sanitation, and masking in public. I believe those are the protective practices that you are encouraging us to abide to.
Yes, that's what it is, of course. Very good that we have established connection, Michael. Will you tell us what you're doing there at Amachara this morning? But that will be later. The program Abia State's COVID-19 update highlights daily reports of the Interministerial Committee on the Control of COVID-19, as well as Abia State Governor Okezie Ikpeazu's effort in ensuring that the state is safe from the virus. It is running simultaneously every weekday, from Mondays through Fridays on several radio stations in the state. We are live on BCA 88.1 FM, Flow right here 94.9 FM, Vision Africa Radio 104.1 FM, all in Umuahia, the Abia State's capital. And we're also live on Buzz 89.7 FM and Real 99.1 FM, both in Aba, the commercial capital of Abia State. As usual, let us bring you up to date on figures and updates on coronavirus globally. Global numbers of deaths is standing at 514,072 as at 8 a.m. today. Meanwhile, the total number of infections worldwide stands at 10,592,134. Also, the number of recovered cases is at 5,801,131. Well, more than 48,000 coronavirus cases were announced across the United States yesterday, the most of any day of the pandemic. The number of new cases in the United States has shot up by 80% in the past 2 weeks. Now, this is coming as top U.S. infectious disease expert Anthony Fauci has warned that the United States could see 100,000 new coronavirus cases a day if Americans do not start following public health recommendations. Over to you, Michael.
Of course, Chioma, those recommendations are to be followed also in Nigeria to break the chain of transmission. Let's bring it back home. The Nigeria Center for Disease Control has announced 561 new cases of COVID-19, bringing the total number of confirmed cases in the country to 25,694. 17 deaths were recorded from the virus yesterday, bringing the total number of confirmed deaths from the virus to 590. Now, given a breakdown of the cases, NCDC noted that 5 states with the highest number of infections were Lagos with 200, Edo State with 119, Kaduna with 52, Niger State with 32, and Ogun State with 19. Others included Ondo State with 16, Imo State, that's a neighboring state, with 14, Plateau State with 11, and Abia State, and also your state recording the same number of cases. Yesterday, 8 cases, and of course Bayelsa with 7 and Katsina State with 6. And on a positive note, 344 more patients have been successfully treated and discharged from the isolation centers in various parts of the country. This brings to 9,746 the number of people who have been discharged so far, although 17 more patients lost the battle to COVID-19. So the NCDC has put the country's death toll from the disease at 590.
Till date, 25,694 cases have been confirmed. 9,746 cases have been discharged, and 590 deaths have been recorded in 35 states and the Federal Capital Territory. There are about 15,358 active cases of COVID-19, and 134,257 samples have so far been tested. There are several ways that you can get tested in Abia State. 1. Call Abia State Helpline. The number 0700 2242 362. Again, 0700 2242 362. Or visit any of the following health facilities: the Infectious Disease Hospital, IDH, behind Nigeria Breweries in Aba, between the time 11 a.m. and 3 p.m. every weekday. The Abia State Specialist Hospital and Diagnostic Center, Amachara, Umuahia, between the time 11 a.m. to 3 p.m. every weekday. And also the Federal Medical Center, Umuahia, from 10 a.m. to 3 p.m. every weekday. Michael is presently at Amachara. Michael?
Yes, Chairman, I'm present at Amachara, not to be isolated or to be tested, but to let Abians know how COVID-19 tests can be carried out, and also visit the testing laboratory here. When a communicable disease outbreak begins, the ideal response is for the public health officials to begin testing for it. Okay. That leads to identification of cases, treatment of those people, and immediate isolation to prevent spread. Testing also helps to identify anyone who came in contact with infected people, so they too can be quickly treated. So it's crucial, of course, to help treat, isolate, or hospitalize people who are infected. So testing is also important in bigger public health picture on mitigation efforts. So helping investigators to characterize the prevalence, the spread, and the contagiousness of the disease. So this morning, right here at Amachara, I will be talking to frontline health workers here involved in testing, and I will also be visiting the laboratory here to have an idea of what happens here. So we are very much on ground. It's a two-way conversation.
Okay.
I have the first person I'm talking to right here. Can we meet you?
Yeah, my name is Dr. Mrs. Ijomandoka.
So what are you in charge here? What do you do?
I'm the consultant in charge of the Amachara Isolation Center here at the Abia State Diagnostic Center. I'm a community physician, a public physician as well. So I have my team with me here at the center.
So we can say on a daily you get in touch or you get in contact with the patients there at Amachara at the isolation center here?
Yes, we have both inpatients and outpatients, our walk-in patients. We're in contact with all the patients that come here for management or counseling here.
On a daily, can you take us through your routine? What you go about, maybe when you wake up in the morning or probably during the middle of the night? How do you go about management of the cases?
Here at the center?
Yes.
Okay. The management of our patients, when we come, basically we don't leave the center. The doctors, the nurses live in here. We have a place where we set aside. When we are done managing our patients, we go to our restroom and stay on there. So we, from time to time, we're going to see our patients 3-4 times as the case may be, but routinely 3 times, morning, afternoon, and night. We check their vitals, give them their medications, and for any time they call us for assistance, we actually go in there, we don wear our PPEs and go and attend to their needs. So that's the routine here. We as well collect samples from those who walk in from contact of our patients. They come in here for us to collect their samples to be tested for COVID-19.
So, doctor, you're telling me that you've been staying at this isolation center. You've stayed away from your family.
Yes, we've been here for 6 weeks running, and it's counting. And then the thing is that when you think you have discharged the last patient, that particular day you have an upsurge. The ward gets filled up again. So we don't really know when we're going to leave here. We'll pray that it will be quite soon. But we've been here for the past 6 weeks. Yes.
Oh, very interesting. I need someone to take us through the process of test now. When someone walks into this center here at Amachara, how do you go about the test? What is the first thing you do? Even down to the level of identification, I want you to explain into details because we're very live on several radio stations in the state right now.
Yeah, thank you. We have our laboratory scientist, Oluchi Adiogo, who has been on ground from the inception, from the first time we have the index case. She's been moving around the state, about wherever she's called. She moves with her team, and on the spot, she gets the patient tested. I think she'll be in the right position to tell us what she does in the field.
All right, let's talk to Madam Oluchi. It is still Abia State COVID-19 update. Of course, we're live on several radio stations, BCA FM, Flow FM, Vision Africa Radio, and also in Aba Boss FM and Real FM. Good morning to you. Can you introduce yourself?
Good morning. My name is Scientist Adiogo Oluchi. I'm the pillar lead, Abia State Rapid Response Team.
Interesting. What do you do?
Okay, I'm the person in charge of collecting the whole samples in Abia State. But I coordinate the sample collections with my team. We have our counterpart in FMC that have been helping in that respect. Then I have my colleague here, Divine Onvarere, and some of my colleagues that are taking care of the testing in Aba Aziz.
So how do you go about taking samples? What do you take? What do you need? For example, a common man on the street walks here and needs to be tested. What are the requirements?
Okay, first of all, we're not testing anybody that comes around. When you come, it will introduce ourselves to you, ask you why you are here, because many people have been coming that they want to be tested for COVID-19. But the truth is that we'll have a case definition that the person will meet before we collect your sample. According to NCDC guideline, the person must be having fever above 38 degrees centigrade. The person must be coughing for over 2 weeks. The person will be having difficulty in breathing, diarrhea, vomiting, nausea. So when you come, we'll ask all these questions. Then secondly, maybe the person have come in contact with somebody that is a positive case. Maybe when a husband tested positive, the wife as well will come. We'll monitor the patient, ask the person some questions, then we'll collect the sample. And the sample we'll collect is, we'll collect in 2 places, the nasal pharyngeal and the oral pharyngeal.
So I want you to break it down. That sounds like a very big medical terminology. Nasal pharyngeal and the oral pharyngeal. So what does that mean?
Okay, we use the material is in swab, a swab-like type. So we use it, we insert inside the person, like the nasal pharyngeal, or inside the nose, right inside the nose to get the pulse there. Then the oral pharyngeal, we use a swab inside the throat, right inside the throat. So, and when we get it, we have a VTM that is being prepared from NCDC. And that VTM is called viral transport media. That is the media that will hold the virus from dying before it's being sent to the lab for further process. So after collecting the sample, there is another important thing we have, the triple packaging process. So we used to, the triple packaging process, you put it in the VTM first. You now wrap with what we call absorbent paper to avoid leakage, and you put into the Falcon tube. Then you now put inside your Ziploc bag, all well labeled with the patient's information.
All right, thank you very much for speaking to us this morning. We have a whole lot of frontline health workers here.
Michael,
we will be
a very
to
quick
another
question.
right? Yes.
How long does it take for the result to come out?
Okay, what happened is that most times, though we started testing in our own lab here in Amachara now, but most times we do send to Abuja, and if we send to Abuja, the procedure is that it will be 48 hours before the result is being released. So when the sample is being collected, within a space of 3 or 4 times at once, the patient will get the result.
Okay, thank you very much for speaking to us this morning. Now, we're still taking a look at what happens here at Amachara Isolation Center in Umuahia, the capital of Abia State. I will be speaking to another frontline health worker very much here. Can you introduce yourself? I can remember the last time I was here was when I was here to drop my sample and you took my sample, but can you introduce yourself?
Okay, thank you. My name is Amachara Divine. I'm the laboratory manager for the Southeast Zonal Reference Lab, and also where we do the COVID-19 testing in Amachara.
So the laboratory manager, what do you do?
Okay, I try to coordinate to see that results are being released, samples are tested under the implementing quality management system to ensure that results given out are accurate.
So yours is about quality control.
Quality management system, yes.
Quality management system. So how do you go about it? What are those things that you take a look at and you ensure that tests are being taken at the right, at a very conducive environment?
Okay, so samples collected in the states are brought to the lab as of now, and like we know, COVID-19 is more like a response. So in as much as we try to want to get the results out on time, in rushing we don't want to see that there are any mistakes done. So it's a response, and at the same time we take our time to make sure that the results given out, everything that should be done, it's done, and we don't miss anything out. So that is what we...
I remember the last time I was here, when I was here to drop my sample, you took some precautionary measures to ensure that these samples you're taking are not even contaminated before it gets to the lab. Can you run us through that? Just a summary.
Okay, the last line of defense, like we say, are your PPEs, which is the personal protective equipment. But that does not rule out the fact that you need to have the basic skills, the good medical laboratory practices. So upon collection of sample, you're properly donned, having your overall, your face masks, your eye shields, the gloves like you saw me do on that day. So these samples are taken carefully and are transported to the lab using our triple packaging. So if you remember on that day, you saw that I put in a container into another container again to ensure that when it is being transported, you don't want any form of leakage that could infect the population. So bringing it to the lab that way. When the sample gets to the lab, at that point to take it over from there and continue with the process.
Thank you very much for speaking to us this morning. Now we need to talk to someone that manages the patient inside the laboratory. I think I should take more than inside the isolation ward. Thank you very much. I think I should take more than 6 feet from you this time around, because you have contact with the patients on a daily. Now, can you run us through your daily routine and then tell us your name?
I'm Dr. Okowa Charles, one of the case managers. And basically what we do is that when any patient comes, we first want to find out, using the case definition, to know if the patient is a suspected COVID-19 patient, or if not, we refer them to either the other sections of the Amachara hospital or to other departments where they can be managed. Basically, we've had mild and moderate cases. We've not really needed to use our ventilators. And when we are done with, we call it triaging, which means you want to find out where they need to go, whether they are going for tests, whether they are going in for management, especially for those who have been tested positive and they are symptomatic. And when they come in, we take their information, their background history, medical history. We examine them while still maintaining the social distance protocol. We have a lot of non-touch equipment that we are using to make sure that we protect ourselves also in the process. We use our PPEs where necessary, and then the next, if they need to be admitted, we admit them. So far we have had no fatalities here in this our center. If you hear of any fatality, it's not among those that have been managed by the state. So we now admit if they require admission, and then we monitor them very closely, managing them with the prescribed drugs. We have guidelines that we follow, international and national guidelines on management of COVID-19 patients.
Very interesting. It must have been a very wonderful experience, I believe. But what will be your message to those, especially Abians, who have a large percentage of Abians still saying that COVID-19 is real? You have contact with these patients on a daily. What do you like to tell them?
Well, first of all, I would like to tell them that it's real. Perhaps people should start taking excursions to the center. You know, when a few people come around, even from a distance, they are surprised, you know, that what is that is happening, you know. Without mentioning the name, one of the banks actually had a branch shut down because a staff was infected, and before you know it, not less than almost 20 staff were infected. A bank will not do that in Abia, right? So, and we have quite a few people, and right now we are even talking to some of those who are leaving us, right, whole and you know, full of full of life, to go and spread the message to those around them, so that stigma is reduced. You get into vehicles, everybody's talking about a scam. We say come around and see what is happening. If we are not visiting our homes for 6 weeks, it's because this is real. So Abians need to get past the point where we have a very low perception of risk to the reality that if the whole world is, you know, is bothered because of this, we can't be left out. So it is real. And then the messages we get from NCDC and from the state about social distancing, masking and all that, they are, you know, the best things we can do for ourselves right now.
All right, thank you very much. I know, Chioma, we have less than 5 minutes to spend on this
program.
Yes, we do. I would like to speak to, I would just like to speak to two or one more person, frontline health workers here, before I hand over to you finally. And we're still
Michael, let's make it 3 minutes.
Okay, thank you very much. Can we meet you? What's your name?
Yeah, my name is Comrade Aligwe Chibiti. I'm the State Secretary, National Association of Nigerian Nurses and Midwives, and the nurse coordinator, coordinating COVID-19 nurses from 9 workers in Amachara here.
Very wonderful. So, what is your daily routine like?
Well, every day in the morning from 8 o'clock, we check patient vital sign, administer drug. In the afternoon, we also check their vital sign, serve them food. If anyone has a special need, we do that too. And in the night, we also do the same. So we go there 3 times in a day to see and know how the patients are doing.
Yeah, I think I'm interested in the food aspect. The food comes from where?
The state government provides the food, the morning, afternoon, and night.
They eat 3 times in a day?
Yes.
What about other essential services like electricity, water supply?
Yeah, all these are made available by the state government. Not only the patient, even those in the frontline healthcare workers are also being served food 3 times daily. Just like the doctor in charge of the center have said before, there's accommodation provided for them. They provide them food 3 times daily, and in terms of other amenities like toiletries and all the things the patient needs are being provided by the state government.
Thank you very much. Just one more person before I hand over to you, Chioma Nkwonta. And we meet you, we have less than 30 seconds.
Okay, my name is Dr. Enileya Samo.
So what do you do at the isolation center here?
Okay, I'm one of the doctors that are managing cases of COVID-19 here in Amachara.
So far, how are the patients here responding to treatment?
Well, they've been doing wonderfully well. In as much as they present on time, we start their management on time, they recover on time, got discharged on time.
Oh, thank you very much, doctor. So that's how far we can go here at the isolation center. For those of you that are still saying coronavirus is real, it is very important to start taking precautionary measures. Chioma, many thanks to Stanley, the video guy here, and also Samson Eze for making it possible. Over to you in the studio. My name is Michael.
Thank you so much, Michael. Thank you. And a very big thank you to our participating stations, BCA 88.1 FM, Flow 94.9 FM, Vision Africa 104.1 FM, Real FM 99.1 FM, and Boz 89.7 FM. This is Abia State COVID-19 update. We have come to the end of today's edition. Hopefully tomorrow we will return with another edition. My name is Chama Nkwanta. Enjoy the rest of your day and stay safe.
This is Abia COVID-19 update. Abia COVID-19 update.